Hi, I'm Shelley Weber Tompkins, and I do acupuncture and I'm a functional medicine provider. And today I wanted to talk about the importance of good nutrition and the right nutrition when you're trying to conceive. And not every two persons are going to be exactly alike as far as what's going to be best for them. But since a lot of people tend to have inflammatory processes going on, whether it's fibroids, PCOS, endometriosis, painful periods, and for males, even vascular issues as far as varicocele in their testes or other issues that might be getting in the way, a lot of it's inflammation based. And so that's why I try to focus on diets that would be really good for helping to minimize inflammation internally and to do that as soon as possible. And so one of the diets that I normally advocate for is the Mediterranean diet, but I go a step further and have people look at the anti-inflammatory Mediterranean diet. And so it narrows it just a teeny bit for factors that may cause inflammation. So it may feel a little restrictive, but if you're diligent with it and you really stay the course, then you can have a lot less problems going into whether, if you're already in the IVF process, this is still important because you're trying to make everything work more effectively. But if you're not in the IVF process, then both you and your partner are trying to work on minimizing anything that might be getting in the way or causing more problems with trying to conceive. And so this one you can look up, and there's lots of recipes that you can get because sometimes that's part of the problem is like, I don't know what to do with that. So look online, Pinterest, Google, all of them have recipes. So once you know what the diet entails, which Google, look it up, it's really a good one. And then you can figure out what foods you need to have in your refrigerator and cupboard, and then look for recipes that make it really simple. You don't have to make it technical. Sometimes just having like a vegetable, a little bit of a starch, and then whatever protein you're gonna have, whether you're vegetarian, vegan, or a meat consumer, then you want to make sure that you have things that are around that are going to fit into that, and then try and get rid of the things that don't. So you're not looking at it going, oh, gee, that looks good in the cupboard right now. I think I'll go for it. So minimizing inflammation is super important. There's also some things as far as noting which foods are good. Depending on whether you have any genetic issues or not, or if you've been tested for them, those can be good to have tested, especially like if you're looking at MTHFR, which is basically a genetic, if you have a variant there that's a problem between you and your partner, then it usually means that you need more folate. Your body is not utilizing it as well as it needs to, and it needs more. So getting a good folate supplement, high enough, not folic acid, but folate. It doesn't have to be methylfolate. It could be a calcium folinic type of supplement. But just do your homework, kind of look through a little bit and find one that works well. Most of the supplements these days, as far as prenatals, do have folate in there, but not all of them. Sometimes if you go for the cheaper brands, they are definitely going to still have folic acid. And if you did have that genetic variant, then you'd want to make sure you're getting folate. And you can ask your doctor for that type of test. They can go through that one and some other genetic testing just to rule things out. And I think that's a good thing to do if you haven't already, especially if you've been dealing with things or trying to get pregnant for a while, looking at genetic factors in male sperm plus in the female for the blood, and just making sure that if anything is there, then you know what to do about it. So, but your green vegetables, your leafy greens especially, are really full of natural occurring folate. So adding those to the mix, making sure that you're getting a lot of, actually in good berries are awesome too, because they don't mess with your blood sugar. They're more fiber rich. And so I usually suggest, blueberries, blackberries, boysenberries, whatever you have around. Strawberries, if you get those, make sure you're getting those organic because they are very highly pesticided. And since we're talking about inflammation, we really want to minimize anything that causes it, which this would. So pesticides are definitely not something we're supposed to have in our system. Unfortunately, it's hard to completely avoid it. So anyway, try and be really good about getting in good organic fruits and vegetables in your diet. Also doing beans and lentils are really good forms, and most people don't always think of these as good protein sources, but they are. So if you're mixing it up with your diet, make sure you're adding some beans that you like, or trying some different recipes with lentils in it. Those are all good. Also getting in more of, well, I mentioned quinoa. Quinoa is one that's it's a good grain, it's complete protein, and you can get noodles that are quinoa also. And so if you're a real pasta lover, and I'm mentioning avoiding wheat products as much as you can because they can tend to be inflammatory too. If you do go for wheat, I would suggest that you go for like if you're doing a bread, a sourdough bread that doesn't have added gluten to it, because that makes it more difficult to digest. And wheat is very highly pesticided, and that's another reason why I'm kind of poo-poo it, because when you're trying to lower inflammation, like I said before, you want to lessen that impact of pesticides. And let's see, what else did I want to mention? Green drinks. So green drinks is another thing that you can add to your diet. If you, some people don't like green drinks, but if you actually find them palatable, then mixing those up, because you're adding more of antioxidants, which are really good for helping your system work more efficiently and helping inflammation. That is the main things I wanted to stress to you, as well as making sure you're getting in 2 good meals a day. And you can always do snacks. One that I like is getting some of the berries. I get blueberries and throw in some pecans, and then I have something that's stabilizing blood sugar with a berry, and then making it even slower in its digestive process, which lessens the sugar's impact by having nuts with it. So you can definitely do a bevy with different nuts, and seeds are also really good. Pumpkin seeds have been found very beneficial for sperm, and so adding that as a snack for your guy is good. We do need, as women, a little bit of testosterone as well in the mix, and so it doesn't hurt for us to have those either. Mix it up with different seeds. Find things that are interesting, that you enjoy, and can help your diet and your overall goal for fertility. So if you have any questions or anything comes up or something you want to talk more about, please DM me. But if you'll subscribe and listen for more, I'll have another YouTube next week. Take care.